If you have been on any social media at all lately, you've probably seen this picture, a billboard from the Agency for Healthcare Research and Quality. As you can see, it says this year thousands of men will die from stubbornness. You can see that somebody, probably a man, painted on it. No, he won't. We do laugh, but it points out how men feel about going to the doctor and having annual medical screenings.
Yeah, and we are talking about men of all ages, so we thought we would talk men's health and what issues men should give their attention to at different stages of life. And who better to address the subject than PRMC's Dr. Mark Edney with Chesapeake Urology Associates. Thanks for being here this afternoon.
Thanks for having me.
That's pretty telling, isn't it?
That's great. It's a funny sign.
Yeah.
And it's funny because it's so true.
Yeah, because do you feel like many men live by the belief that if it ain't broke, don't fix it?
They do, Lisa, and I think in a lot of areas of life that may be decent advice if you're talking about the home or the car. The problem is when you're talking about health, there are so many conditions, whether it's cancer or other health conditions that don't cause any symptoms. And that's a common misnomer. If men feel like, hey, if I'm not having pain, there must not be a problem. And it's a very wrong assumption, and waiting until there are symptoms can be the worst scenario in the world, because if it's a cancer, you can get it when it's too late. Or if it's another health condition, it can cause a lot of damage without causing any symptoms before the time you get a chance to find it.
So that was one of the things that we said in promoting the segment. If it doesn't hurt, don't ignore it. And I'm thinking, well, wait a minute, how in the world are we supposed to? But it's about screenings, isn't it? It
absolutely is about screenings, and there are lots of screenings available now for the most common kinds of particularly cancer that can affect men as they get older. The three most common kinds of cancer are first lung cancer for men, then prostate cancer, and then colon cancer. And in fact, there are screenings for all of them. For lung cancer, these are men who have at least what's called a 30-pack year history. And this is for men and women, but we're talking about men's health today. But for men and women with a 30-pack year smoking history, and to get to pack year, you just multiply the number of packs a day that are smoked times the number of years you've done that. So if you've smoked a pack a day for 2 years, you have a 2-pack year history. If you have at least a 30-pack year history and you're between the ages of 55 and 74, there's good data now that a CAT scan of the chest, not a chest x-ray, a CAT scan of the chest is a good way to screen for lung cancer, and that's relatively new data. The screenings that have been around for a while, now getting back to just men, prostate cancer. We've had the PSA blood test for decades now. There's some controversy around the PSA blood test. People will have heard of the U.S. Preventative Task Service's recommendations that are back and forth about whether or not it ought to be broadly applied. We in urology feel it's a critically important test. We need to be selective about the men in which it's used, but most men who are healthy ought to be at least offered the PSA blood test to screen for prostate cancer, because it is such a common cancer. And again, it doesn't cause any symptoms. So I have a lot of guys that come into the office and I'll review their screening and I'll say your PSA was normal, your exam was normal, your prostate's healthy. And they say, I knew that, I wasn't having any symptoms. It's a fundamental misunderstanding that symptoms don't necessarily go with cancer. You can develop cancer of the prostate and have 0 symptoms. And finally, colon cancer. We've got great screenings for colon cancer, and everybody's aware of the colonoscopy, which is recommended at age 50 for people at average risk. And so those are the top 3 cancers that threaten life for men as they age, and we've got good screenings if there are risk factors for all of them.
Yeah. Okay, so let's talk about one subject that's not often talked about, and that's testosterone deficiency. Is that common with age?
It is. It's a normal part of aging, and that's a message that gets lost on a lot of men. There's been a lot of what we call direct-to-consumer advertising by these drug companies that sell testosterone. So everybody has seen the advertisements, both for testosterone and also for all of the supplement companies out there, offering that, for men to get back in the game and all sorts of other things, revitalize their life, get more energy, and all of that's related to sort of this direct-to-consumer testosterone marketing. So men are coming into the office saying, their first question is, will you please check my testosterone? Because I've got a variety of symptoms that may or may not be related to low testosterone. But to your point, Lisa, it's a normal part of aging. Just as women get older, their estrogen decreases. As men get older, their testosterone decreases. It decreases, in fact, by about 1% per year after the age of 30. So the decline in testosterone is normal. Now, whether or not that decline causes the constellation of bothersome symptoms is another issue. If you're suffering from the constellation of symptoms that it can cause, it's reasonable to check the testosterone and to talk about replacement. But replacement isn't a free ticket either. It comes with risks, and we got to talk about that with men. We have to have that conversation.
Yeah. Now, in general, we're not just talking older men.
Correct.
Right?
Correct, yeah, no, absolutely. Younger men come in asking about testosterone as well. And again, there are conditions that younger men can get where their testosterone actually is lower, whether it's failure at the testicular level, right, or more centrally where those hormones are controlled. Young men can have low testosterone, but also young men can also have a variety of symptoms that they think is low testosterone, and they come in demanding the test. And the risks of testosterone replacement are different in younger men compared to older men as well.
But not just testosterone. Broad scope. We're talking not just older men, younger men have screenings they need to do too.
Absolutely. The one cancer screening that younger men need to be aware of is testicular cancer. Now, testicular cancer is not very common at all. Yeah. However, the peak age that it occurs is in the 20s and 30s. So it's important that younger men do testicular self-exam. And it's just every once in a while, get in the habit of checking yourself. And if you feel anything abnormal, talk to your primary care doctor or call the urologist office to have a professional exam. But that's the one screening that young men need to be aware of.
If there's one message that all men could take away from your appearance here, what would it be?
Don't wait until there are symptoms. You know, especially as men are getting older, get your cancer screenings that are available to you. For younger men, when we look at the common causes of death, it's not cancer in men in their 20s, 30s, and 40s. Number one is accidents. Okay, it's from risky behavior. And so my advice to younger men is try to keep a healthy diet. You know, drink alcohol in moderation, don't use illegal drugs, certainly don't drive a car after you've been drinking or using drugs. These are all the things that cause a lot of death, and they lead to a lot of you know, health problems, obviously, down the road. So it's safety really is the issue for younger men, and then as men get older, into their 50s, 60s, and 70s, it's worrying about heart disease and cancer.
And don't smoke.
Exactly.
All right, Dr. Edney, thank you so much.
Yeah,
very important
good.
information from Chesapeake Urology Associates.